Hi everyone, so this is our endocrine case study featuring Hannah, Dora, John, Michelle, and Karina. About the patient. Patient is a 46-year-old female elementary school teacher. Symptoms that she's been reported feeling is that she's been feeling tired for the last couple months. Overall, she's been having muscle aches and joint pain and currently has stiffness around her neck. She was diagnosed with hypothyroidism 3 years ago. Comorbidities include type 2 diabetes, hypertension, and she's currently overweight. Family medical history shows that her grandmother had hypothyroidism as well. Now, after hearing all those symptoms that our patient currently has, what disease do you think this is? It is called Hashimoto's disease.
The thyroid is an endocrine gland anterior to the trachea and inferior to the larynx. It contains two lobes connected by an isthmus. The thyroid is made of lobules which contain thyroid follicles. These follicles are the functioning portion of the thyroid gland. The follicle lumens hold and store colloid solution called thyroglobulin, which, when combined with iodine, can form the thyroid hormones T4 and T3. The follicles are lined with follicular cells which contain enzymes to synthesize thyroglobulin as well as enzymes needed to secrete the thyroid hormone into the bloodstream. In the thyroid gland, there are also parafollicular cells which secrete calcitonin into the blood in order to reduce calcium levels by depositing it into bone. Thus, it works in opposition to parathyroid hormone. The thyroid gland works by way of a negative feedback loop to the hypothalamus and the anterior pituitary. The hypothalamus releases TRH, thyrotropin-releasing hormone, to the anterior pituitary, which then releases TSH, thyroid-stimulating hormone, to the thyroid. The thyroid gland then releases thyroid hormone in the form of T3 and T4 into the blood. The negative feedback loop from the thyroid will affect the hypothalamus and the pituitary, regulating the amount that is released from them to produce the maximum desired amount of thyroid hormone. The main functions of the thyroid are many. It is essential to basal metabolic rate regulation. Thyroid hormones overall help growth, development, and differentiation of cells in the body. Thyroid hormone also is very important in the development and function of the central nervous system in children. As mentioned before, it helps deposit calcium from the blood into the bone, making those bones nice and strong. Thyroid hormone also regulates carbohydrate, fat, and protein metabolism, as well as helps in the metabolism of vitamins. It also regulates the body temperature and enhances mitochondrial metabolism. Thyroid hormone also influences the mood and behavior of a person as well as stimulates gut motility. Hashimoto's thyroiditis causes hypothyroidism and is one of the most common thyroid disorders. It is more common in women and Caucasians than in men and other ethnicities. Hashimoto's is an autoimmune system disease, and the pathogenesis is still unknown and highly debated. Factors believed to play a role in the etiology include environment, genetic, and epigenetic factors. Environmental factors include the absence of microbial agents in someone's environment. This can cause an allergic response when introduced later in life, as well as autoimmune diseases. The amount of iodine consumed may also be a factor for onset. Studies have shown that excessive iodine in the diet may be a cause of Hashimoto's thyroiditis in predisposed individuals. Vitamin D deficiency is often found in patients with Hashimoto's. This may be a result from Hashimoto's, though, as a dysfunctional thyroid will deter the absorption of vitamin D. Genetic factors include mutations of immune cells in the body. Specific genes have been identified that may lead to Hashimoto's. Human leukocyte antigen complex is a gene that helps control the immune response. Other immunoregulatory genes such as CTLA4, PTPN22, and CD14 will lead to the breakdown of the immune tolerance. The gene NLRC4 is involved in the innate immunity and acquired immune process. Polymorphism of this gene leads to immune dysfunction, resulting in further damage to the thyroid due to the immune cells entering the thyroid gland. Blood tests will show elevated levels of antibodies to thyroglobulin and thyroid peroxidase. These antibodies will attack the thyroid gland and cause apoptosis of thyrocytes. Epigenetic factors, which determines whether a gene will or will not be expressed, also plays a role in Hashimoto's. Environmental factors may influence modification in epigenetics, causing activation or inactivation of a specific gene, which may cause the onset of Hashimoto's in susceptible individuals. This slide shows the activation of the T cells and T cell subsets. If those T cells are not affected by alterations, you have immune homeostasis and the thyroid gland is supported. However, if there are mutations with those cells, it will have a loss of immune tolerance and the thyroid autoimmunity will be affected. These cells will then go on to infiltrate the thyrocytes and cause destruction of them through apoptosis.
Diagnosis and medical treatment. So after reviewing her symptoms of fatigue, muscle aches, slow movements, joint pain, stiffness around the neck, irritability, and therefore a change in behavior, in regards to tests and imaging, we would want to check her vitals, run a TSH, T3, and T4 blood test to help indicate if she has an autoimmune condition. We can also do a thyroid scan and ultrasound just to get more imaging and also test her thyroid functionality, and then also a cytological examination to test for the presence of lymphocytes with thyroid cells. This is to help us differentiate between Hashimoto's and or thyroid cancer. So if you look to the images to the right, in image A, this is a histologic view of Hashimoto's disease with thyroid carcinoma. In image B below, this is a view of the effacement of the thyroid, diffuse lymphocytes, and the residual thyroid follicles with Hashimoto's disease. In terms of treatment, she would have to take levothyroxine 4 or LT4 medication to help control the hypothyroidism, and this would be taken over the lifespan just to achieve normal TSH levels. We would also suggest vitamin D supplements for deficiency, a thyroidectomy, but only if necessary, because the gland is very close to the two branches of the vagus nerve, and if this nerve is damaged, it could lead to difficulty breathing, hoarseness of the voice, and difficulty singing. And then lastly, a biopsy, and this will be done only every couple of years just to detect cancerous tissues.
The Hashimoto's disease impacts the ability to engage in occupations. Specifically, with the effects of the levothyrox medication, we were able to interview this patient, and they were telling us that they can experience and did experience irritability, mood swings, and diarrhea. With these effects, her occupations in her daily life, such as showering, cooking, cleaning, and getting dressed, is impacted, as well as her occupation as being an elementary school teacher, because they do a lot of writing and talking, and also impacting her favorite activities, such as reading, walking, and playing board games. And with these effects and the treatment plan that is needed, it will impact her lack of motivation, endurance, strength, and focus to do these occupations. The progression of the Hashimoto's disease on occupations will eventually lead to depression without addressing the activities that are meaningful to her and her independence to perform her activities of daily life. Plus, will lead to early retirement or change in career because of the depression and because of the fatigue, and then will equal to a decline in a fulfilling life.
Utilizing a top-down approach, we were able to think of interventions that were part of our client's daily occupations and develop a treatment plan based on her performance levels in those occupations. So from this, we concluded that increasing endurance would be very important. We would have her do this by playing Simon Says while sitting down, and then eventually move up to more intensive games like Twister. We would also incorporate activities like chair yoga to strengthen her neck muscles while decreasing stiffness. Regarding her mental health, we would help her discover resources of social support, like referring her to her psychiatry department and exploring options that she has not utilized before, like an extended family member to talk to or even a neighbor to connect with. Incorporating energy conservation knowledge was also important because then she would feel less fatigued and more motivated to go about having a meaningful day within her occupations. Some tools that we suggested to assist the client during her activities of daily living included a chair and an extended scrubber for her showers, since her endurance and range of motion was declined. Another tool we thought of was using a reacher that was lightweight and easy to grasp. While sitting down, she can use this to pick items up without having to actually get up, and this would help her save some energy. Focusing on managing and improving our clients' mental health, we suggested writing in a journal like passion planners, which are very structured. These are nice because we are able to give her an outlet to express her emotions of gratitude and troubling thoughts, while also being able to think about her personal goals and what sparks motivation for her. Journaling would also help increase her endurance to work up to writing full lesson plans and grading her students' papers during her occupation as a teacher.
What is something that you learned about Hashimoto's disease? Thank you for listening.